Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about Addison's disease. When you think of Addison's disease, just think of it as being opposite to Cushing's disease. However, it's more that Addison's disease is characterized by insufficiency of all the hormones produced by the adrenal cortex. So, before going into Addison's disease, it's important to revise the anatomy and physiology of the endocrine system, as well more so focusing on the adrenal cortex and its hormones. So here we have the brain. Within the brain is an important endocrine area called hypothalamus. Below the hypothalamus are the pituitary glands, made up of the anterior and posterior pituitary glands. In this part, we are only going to focus on anterior pituitary gland. Here, I'm depicting circulations, which is the blood. And here is one of the adrenal glands. We have two adrenal glands sitting above two kidneys. The adrenal glands has a cortex, the other part of the adrenal gland, and it has a medulla, which is the inner part. The adrenal gland produces hormones in response to the brain, specifically in response to hypothalamic pituitary axis. The hypothalamus produces a hormone called corticotropic releasing hormone. Corticotropic releasing hormone stimulates the cells within the anterior pituitary gland to secrete the adrenocorticotropic stimulating hormones, or ACTH for short. ACTH will then enter circulations. ACTH will travel towards the adrenal glands, specifically to the adrenal cortex, where it will stimulate the adrenal cortex to produce and secrete hormones. The hormones produced by the adrenal cortex are three, and they are categorized as the mineral corticoids, such as aldosterones, corticoids such as cortisol, and androgens. It is important to note that androgen secretions from the adrenal cortex has a minimal role in males. Rather, it has more of important roles in females. Androgen in men are mainly produced by the testes. An increase in cortisol in circulations will have a negative feedback on the hypothalamus. It will tell the hypothalamus to stop producing any more corticotropin-releasing hormones, thus decreasing the stimulations of the adrenal cortex hormones production. So what do these adrenal cortex hormones actually do? What does the middle corticoids, glucocorticoids, and androgens do exactly? Well, the mineral corticoids, mainly aldosterone, has a functions to increase the sodium and the water retentions in the body. And they primarily work on the kidneys, and so they retain sodium and water, resulting in an increase in blood pressure. Glucocorticoids such as cortisol does many things. The effects are usually long-term and is often referred to as the stress response. Effects of the cortisols include immunosuppressions, and because it is immunosuppressions, it is also anti-inflammatory. This also means that the infections risk increases. Glucocorticoids has a profound effect on metabolism. It causes weight gain and insulin resistance. Glucocorticoids causes skin thinning, and in the bone, glucocorticoid stimulates osteoclastic activity, which are the bone-eating cells, resulting in increased osteopenia and osteoporosis, which is bone with low mineral density, increasing the risk of bone fractures. Finally, cortisol itself has an effect on the blood pressure, which will increase the blood pressure. The androgen secreted by the adrenal glands, as mentioned earlier, has more effect on the females. From what we have learned, we can see that the adrenal glands have a big role in maintaining our body's homeostasis. Overproductions of the adrenal cortex hormones can cause big problems, but also underproductions of adrenal cortex hormones have severe consequences. Addison's disease is essentially any cause of primary adrenal cortex insufficiency, or in other words, a decrease in productions of adrenal cortex hormones. So let's look at some examples. Again, here we have the brain. We have the main structures to focus on the hypothalamus and the anterior pituitary gland. Here is the circulations of the adrenal cortex that have receptors on them. Here is the receptors on the adrenal cortex. The hypothalamus releases the corticotropin-releasing hormones, which stimulates the anterior pituitary gland to produce adrenocorticotropin hormones, or ACTH for short. ACTH goes into circulations and stimulates the adrenal cortex as mentioned earlier. The main cause of primary adrenal insufficiency and therefore the main cause of Addison's disease are antibodies being produced against the adrenal cortex cells, as well as plus-minus 21 hydroxylase enzymes within the adrenal gland. And these antibody productions actually accounts for the 70% of cases of Addison's disease. The autoimmune attack of the adrenal cortex causes damage and therefore reduces the productions of the mineral corticoids, glucocorticoids, and the androgens. A decreased productions of the mineral corticoids will cause a reduction of the sodium and water retentions, and so will reduce the blood pressure. A decrease in blood pressure will cause tachycardia as a compensatory mechanism. A reduction in androgens does not really have an effect on males, rather more an effect on females, causing a decrease in libido. Basically, the opposite effects of what glucocorticoid steroids would otherwise do. This means that the people with Addison's disease will have a weight loss of skin pigmentations and fatigue in general. Further, because there is a decrease in glucocorticoids, this means that the negative feedback is off. Remember, negative feedback only occurs when there is an increase in hormone levels in the blood. With no negative feedback by the glucocorticoids or cortisol, the hypothalamus will produce corticotropic releasing hormones and therefore stimulate the anterior pituitary to produce more adrenocorticotropic hormones. The increase in corticotropic releasing hormones will actually stimulate other hormones producing by the mature 3 gland, including prolactin. So now, the question is, what are the effects of having reduced adrenal cortex hormones levels? What are the effects on the body? Clinical presentations, as we've learned, Addison's disease is essentially primary adrenal insufficiency. And so the clinical presentations include tiredness, dizziness and nausea, weight loss, vomiting, diarrhea, abdominal pain, hyperpigmentation, which is generalized decrease in libido, which is mainly in female, arthralgia, and myalgia. On clinical examinations, there will be a low-grade fever, signs of dehydrations, and loss of hair. You can also note that cachexia, as well as postural hypertension, which is a decrease in blood pressure, the difference between lying down and standing up. Finally, tachycardia is also present to compensate for the low blood pressure. Let's go back to the main diagnosis. However, there are other causes, including infections, adrenal cortex malignancy, secondary malignancy of the adrenal cortex from metastasis elsewhere such as the lungs, adrenal cortex hemorrhage or infarctions. The patient might be on warfarin, which predisposes them to this. Addison's disease can be caused by infiltration diseases such as hemochromatosis and amyloidosis. There are also iatrogenicals such as removal of the adrenal glands, which will obviously cause a reduction in the adrenal cortex hormones. A rare congenital causes characterized by ambiguous genitalia, and this is known as the congenital adrenal hyperplasia. Finally, medications that can cause a decrease in cortisol productions can cause Addison's disease. This includes etomidate methotane and aminoglutamide. Some of these drugs of which are usually used to treat Cushing syndromes. Risk factors for Addison's disease include female gender, because most autoimmune diseases actually tend to occur in females. Having an autoimmune disease, adrenal cortex, autoantibody productions, adrenal hemorrhage is another aspect, tuberculosis infections, meningococcal infections which are adrenal hemorrhage.